Well, there's a new report by Rice University's Baker Institute for Public Policy showing many of the nation's most prominent hospitals are blatantly violating federal mandates requiring pricing transparency. Now, to talk about this very important issue with us is Mara Short, a scholar in health economics at Rice University's Baker Institute and also a co-author of the report. Mara, thanks for being with us.
Yeah, good morning. Thanks for having me.
So basically, we're following up on this federal mandate. Basically, explain to our viewers, laws were created to have simple, understandable pricing for patients, and the hospitals aren't following through. Is that basically it?
Yeah, that's correct. So the hospitals have been told that they need to have, 300 shoppable services available on their website for people to go on and find the prices for and be able to compare their options. And we took a sample of 61 hospitals that were highly rated in quality and checked to see whether they were posting a part of this list. So the cash price, the minimum and maximum negotiated prices that are paid by insurers. And we did this for 6 of those 300 shoppable services. We found that only about a third of the hospitals had those 3 prices for those 6 services. Many of the hospitals had posted either incomplete information, or they may have been requiring you to enter your insurance coverage to find out what price you would be paying. And while that type of website could help like an individual insured consumer find out what they're going to pay, it doesn't give them an idea of how much they're paying relative to the alternatives. Right. Furthermore, an employer couldn't go on and figure out whether their insurer is actually getting them the best price or not. So full price transparency would actually aid both patients and payers in choosing the most cost-effective providers, but we're not having that yet.
Right. A good chunk of those are missing. So looking closer then at the report, you found there can be a large difference in procedure prices depending on where the patient goes.
Absolutely. And keep in mind that we were examining only high quality hospitals. So it's less likely that these differences in prices are actually driven by quality. So for example, we found that for joint replacements in Chicago, the minimum negotiated prices ranged from $4,500 to over $16,000. We also found differences within hospitals. So for example, again, for joint replacement in New York, there was one hospital that had a cash price of $82,000, while their minimum negotiated price was only $16,000.
Wow, quite a range. Can you tell us a little bit about how Houston hospitals fare?
Yeah, we're not doing great. So among Texas hospitals, only 45% of them are in compliance with the transparency rules based on the sample of services that we've looked at. And of those Texas metropolitan areas, Houston is with the lowest percentage. So we're looking at only 16% of hospitals complying as of January. So while we're able to say, we have these large price differences in some cities, we actually haven't been able to do that analysis for Houston.
Interesting. We always talk about, the kind of leaders that are in the medical community in this town and in this area. So I don't know if that'll surprise people. I know it's a big fish to fry, if you will, to catch up. Anyway, what are some of the fines that are being associated with hospitals that aren't being straightforward, or are these even being enforced? I mean, what do they do next?
Yeah, so the fines actually started off really inconsequentially small, particularly for large hospitals with large profits. They were about $300 a day. And it's the Center for Medicare and Medicaid Services, as well as the Texas legislature, went in and made some new rules to raise those. But unfortunately, the Texas Department of State Health Services is not following the language of the new Senate bill in the way that it was intended. So that means fines have increased, but they're still much lower than was intended by the legislation, and lower than is likely necessary to achieve compliance by the large hospital systems. So for example, a hospital is facing, that makes $100 million in revenue, is facing a fine of $365,000, when if taken the way the legislation was written, that fine could have been up to $65 million.
Okay. So enforcement continues, and obviously this study was needed to obviously start to unwrap how much work really needs to be done to get full transparency. Mara Short, thank you so much for your time this morning. Really appreciate it.
Yeah, thank you.